Good evening. On behalf of the entire team at NAMI Racine County, thank you for joining us. I'd like to give a special thanks to our advocacy committee who planned this event and take a moment to appreciate the panelists behind me who have volunteered their time to be here. My name is Bridget Munson and I'm honored to be the executive director at NAMI Racine County. We envision a compassionate community where all people affected by mental illness live healthy, fulfilling lives. In addition to support groups, education programs, and outreach, we're mental health advocates. Hosting events like tonight's Mental Health Services Information Panel not only connect our neighbors to resources, but help to ignite conversation about mental illness and mental health to reduce stigma. We greatly appreciate you being here with us tonight. I'd like to invite up Pat Bohan, Board President, to introduce the panel.
Bridget. Well, good evening and welcome everyone. As Bridget said, I'm Pat Bohan, President of the Board of Directors and Chair of the Advocacy Committee. I want to welcome you to our panel discussion on mental health services available in Racine County. We have an esteemed group of panelists behind me and they'll be sharing important information on their different organizations and services provided throughout the county. So I'd like to briefly introduce the panelists, and then we're going to give each a chance to present important and relevant information and also then respond to any questions that you may have. So kind of moving from my left to right as I face you, we'll start with Jelena Jones and Natalie Meinert from the Behavioral Health Services of Racine County. BHS provides a comprehensive array of mental health and substance abuse services, including outpatient evaluation, psychotherapy, and counseling. BHS has licensed mental health and substance abuse counselors to assist individuals. Additionally, BHS provides services to people who have psychotic disorders requiring services not available through the private sector. Cost of services is based on ability to pay. Next is Reynaldo Ortiz-Maldonado, child and family therapist in training at Children's Wisconsin. Children's Wisconsin is the region's only independent healthcare system dedicated solely to the health and well-being of children. Children's offers a wide range of care and support for children of all ages. Their services include medical and dental care, child and family counseling, foster care, adoption, social services, child advocacy, and injury prevention. And also with us this evening is Amanda Busack. Am I close?
Yep.
Okay. Short-term memory is always a question, but and she's the public health strategist with our Racine County Public Health Division. The Racine County Public Health Division is responsible for providing public health services to many communities throughout Racine County. Their mission is to improve the health of the communities we serve through health promotion, disease prevention, and protection from health and environmental hazards. Racine County Public Health Division monitors the health concerns of entire communities and aims to prevent health problems before they occur. As we all know, during Mental Health Awareness Month, mental health is an important issue that affects individuals and families across our community. We hope this conversation will shed light on the resources available to those who need them and help break down barriers to accessing care. Everyone here will have an opportunity to ask questions to the panelists at the end of the presentation, so please keep that in mind. We are recording this presentation to make this information available to those who could not attend this evening, so look for content on our social media posts, our YouTube channel, and elsewhere going forward. So now we'll kind of begin the panel discussion, and we'll start with Jelena and Natalie. Thank you.
Thanks for having us. I don't know.
We're gonna like way out here. I don't like talking to microphones, it freaks me out. So, like they said, I'm Natalie Meinert,
Jelena Jones.
We're from Racine County Behavioral Health Services. We are the county's arm of behavioral health services in Racine County. So today we're going to talk about, we have a presentation, but I think it's going to be easier if we just talk to you guys. we're going to talk about the different services that the county offers for related to mental health. The first one we want to talk about is something called the Comprehensive Community Services Program. It is a case management program for people for children to adults. You have to be a Racine County resident. You have to have Medicaid. But also, the whole point of being in CCS is for people to be in recovery, to work on goals, to get them to where they want to be. So whether it's be stable in their mental health, whether it's going back to school, keeping a job, figuring out daily living skills, whatever that should be, those, as long as you're working on towards those goals, you are eligible for that program. There is a dedicated, you are assigned a case manager, so you have a case manager that you work with regularly. You can have another case manager who helps teach you those types of skills, and then they help connect you to services that's related and specific for you. Now let's go talk about CSP then.
Okay, so the Community Support Program, also referred to as CSP, is for individuals 18 or older. So the difference between CCS and CSP is obviously more detailed long-term as far as the services provided. You also have to be 18 years or older. The individuals in CSP are normally dealing with some severe or persistent mental health issues. And with that being said, typically what we're trying to do is work with that individual and make sure that they have the services that they need in place to remain as independent as they can in the community. Most of the individuals that we work with, we've built a very good rapport with, so we take pride in that. And I think the main logic behind it is making sure that any services that are needed are basically just the same way Natalie talked about the case management services is the same thing that we're providing for CSP consumers. So we're making sure that, you know, we have a psychiatrist that is on duty and assigned to each individual in CSP. They know the consumers that they're working with very well. We also have a nurse that is in the program and oversees, you know, medication. We have the case managers and obviously the coordinators within the program as well. So what ends up happening is we make sure that we're coordinating the care. Again, in your treatment plan, you're coming up with goals that you're trying to work towards. At times, you know, there may be, like Natalie said, there might be more short-term goals or more long-term goals. Some long-term goals could be mental health stability, making sure that you're staying on medication, connecting to other resources that may be available. With that being said, most of our individuals that are in CSP typically stay with us long-term and make sure that they're sustaining their stability in the community. With that being said, some of our folks, when they end up leaving the program, they're usually aging out into like more of long-term care services, and we're trying to make sure that, you know, their needs are met that way, so that we work on the back end of making sure that when they're making that transition to other programming, that they're really we're advocating to make sure all the loopholes and any cracks in the road may be filled to make sure that they're not falling through the cracks of that.
So those are our two big case management programs in the county. The other big arm that we kind of want to talk about is our crisis program. So crisis is a state statute that mandates us to provide crisis services to people who are in Racine County. People who are maybe just driving through Racine County and having a mental health crisis, or people who live here. Part of crisis is that we've divided that into different units. So our different units do slightly different things, but the main goal is to help that person who maybe can't deal with the mental health crisis that they're facing either by themselves, maybe they need extra support to work through that. So, but the ultimate goal is to help that person return back to their baseline and help them figure out maybe how this doesn't happen in the future, make it to lessen the impact of that in the future. So the first program we're going to talk about then is mobile response.
All right, so just to kind of explain what mobile response is, those are the individuals that are typically coming out and doing mental health assessments in the community for anybody that may be experiencing any type of crisis situation. The normal way, I'm going to jump ahead a little bit here, the normal way that these referrals come through is through our county crisis line. I did bring in some cards. It's the 638-6741 number, available 24 hours a day, 7 days a week. We have an array of individuals contacting that line. It may be people that are known to us. involved in, various programs within behavioral health services. And really those individuals are contacting our line. They may have a distressing factor for that day. They just want to kind of talk through. Other times it's escalating to the point of, a concern for safety. We want to make sure that that individual's needs are being met. So when we receive those calls, if a referral is needed, which our workers that are answering that crisis line are aware of, if there's some concern for safety, what they're doing is making a referral over to our mobile response unit. The reason that you see these different names is because crisis is so large, and for the sake of our own sanity, we want to make sure that we have different units of folks that are serving, the workers that are serving the community. So the mobile response unit is just like that crisis line, operationalized 24/7. There's no days off there, and basically when we receive a referral, sometimes we may get them from law enforcement, we may get them from hospital staff. It may be a neighbor or a friend saying, hey, I'm worried about your, this individual's safety, and I want to make sure that they have the services that they need. And sometimes some of this stuff can be a little scary where you don't know where to head. So sometimes it may just be a call of, wanting us to come on and talk to the individual, offer resources, etc. So mobile response typically receives referrals, as I said, any time of the day. When we receive those referrals, we go out and complete our mental health assessment. So in that mental health assessment, it's not only what are you going through right now, what triggered your event. However, we're looking at, the background of what that individual has been dealing with, the services that, they could probably benefit in their life with. And our ultimate goal is making sure that we're connecting the community to the services that are available. And if they aren't available, we're trying to figure out a way to make them available to them. So with that being said, sometimes individuals may meet with us, and like I said, they know that they need some more resources, or we're connecting them to those. Other times they may be trying to use our crisis hostel sale, and Natalie, we will talk about that in a bit. Other times, there may be occasions where individuals saying, hey, I might have to go into inpatient to seek a psychiatric hospitalization at this point in time. And what we really aim to do is come alongside that individual and make sure that they're connecting to those services, and there's no barriers in obtaining those mental health services that they're seeking at that point in time. The last sliver of what crisis mobile response is able to do is a Chapter 51 detention. Anybody that's aware of that state statute is really driven to make sure that all individuals end up safe if they're experiencing a mental health crisis. Like I said, that is a very small sliver of what we actually do, because our ultimate goal is making sure that we're preserving people's rights and making sure that they are driving their own mental health care.
So, if our mobile response team are the ones who are going into the community and going to homes and schools and wherever somebody is having a mental health crisis is to de-escalate that situation, to compare it to would be more of the first responders, there's something immediate happening, we're going out right now. Another branch then of our crisis team is our crew/ongoing unit. So the point of crew and ongoing is to, one, follow up with the people that maybe mobile response in contact with the night before, making sure that they have stabilized back in the community correctly, have been connected to the resources that they need to move forward, and help them maybe develop a crisis plan going forward as to what will prevent them from going into crisis again. The other part of what they do then is kind of more of the slow roll of mobile response. So let's say it's somebody that the police have had several contacts with, but they don't know how to help that person effectively, or somebody's calling our crisis line, or maybe they're coming here to the library and people are aware of them and they're like, hey, I think this person needs help, but I'm not sure how to help them. Our crew workers then will go out, try to engage that person, sometimes cold knocking on their door, cold calling them, and trying to connect them to services and try to engage them in seeking mental health treatment and to get the help that they're needing. So sometimes that can take a little bit longer. It's not, you're not in the middle of an emergency, but there's something brewing. We're trying to head it off before it becomes a full-blown, up the level to 10 emergency. So then, I'm gonna talk about that. So then we have the assessment center. The assessment center is our walk-in crisis center. It's at 1717 Taylor Avenue. So somebody can walk into the assessment center and they can have, they can meet with a crisis worker at that moment and de-escalate whatever situation they're having, ask questions, talk to somebody in that moment, and do kind of crisis counseling. So based off that crisis counseling meeting, they could decide that, you know what, that was good, that's all I needed, I don't need anything else, and they go along their merry way. They can maybe come back and talk to that person again if they need to. That between the crisis worker and the person who's coming in, we can try to connect them to whatever resources they need. Whether it's maybe you come and see a crisis worker until you can get in to see your regular therapist or psychiatrist. Maybe it's you need to get connected to our sale program. Maybe it's you know, I just need to talk to somebody about my rent and it's what's the driving crisis I'm having today, and I just need to talk that through. So whatever the situation is, our assessment center then can meet with that person, talk them through, maybe develop a crisis plan, develop a response plan if need be, and help them move forward from there. So, want to talk about crisis plan?
And I think just to piggyback off of what Natalie's saying with the assessment center, I think obviously the county has taken great pride in the mental health services that we're able to provide to the community. With that being said, having that walk-in capability for somebody experiencing a crisis, obviously we have our mobile team that can go out and be deployed, you know, any time of the day or night, if someone's experiencing a mental health crisis, but it's truly having that support. We know at times that mental health services are not accessible at times. Sometimes there's a little bit of a waiting period and folks need to get in right away and be seen. And that's when our crisis counselors are available and able to have a conversation.
I forgot to mention, do you want to tell them the hours for the assessment center? Sorry.
Yep. So the hours are 8 to 5. Typically when individuals are coming in, our normal times are probably about 10 to 3 or so during people are awake and people are up and moving, should I say. So people are walking in. The ultimate goal, like Natalie said, when people are walking in, it's really to make sure that they're receiving the services that they need and they're aware of the services that they can also connect to. Whether that is, you know, us having a conversation regarding our Community Comprehensive Services Program, CCS, whether it's the Community Support Program, any other, you know, AOTA counseling that we may have at the clinic, whatever else they're looking for. So with that being said, many of the individuals that contact our crisis line, they are contacting our crisis line saying, hey, I'm looking for these services, I may have a barrier in finding these services. We try to connect them with that. It doesn't only have to be mental health services. Sometimes folks are calling us about, hey, do you have any information on housing resources? How do you connect with, you know, applying for state benefits if you're looking for, you know, Medicaid, food share, whatever it may be. We're trying to look up those resources and trying to provide that information. If we don't have it, we try to find it. And then that crisis line, with us answering it 24/7, we're obviously able to identify certain individuals that may use it for additional support. Other individuals that are not known to us, we try to learn, you know, exactly what they're looking for, what they're trying to connect to. So the crisis line is always there. Like I said, we brought in the handouts that can be dispersed for anybody that's not aware of the crisis line. And then lastly, our sale program. So our crisis hostel is 15 beds. We are strategic at times if we ever are full or if there is, you know, anything going out, you know, in our surrounding counties that we try to assist them in providing crisis to their community and especially points of distress. I know not too long ago, it was about a year ago when Kenosha had a little bit of an uprise. We'll utilize and try to partner with our neighboring counties to make sure that, you know, the services are always available. So with that being said, typically length of stay at sale. Somebody coming or seeking services at sale is typically staying about 3 to 5 days for crisis stabilization. Many individuals, you know, ask, well, what would an individual be coming to sale for? Well, everyone's crisis looks a little bit different. So with that being said, when they contact the crisis hotline, they can show up at our door. We're located at 2000 Dominic Avenue as well. Sometimes law enforcement brings people to us. Sometimes the hospitals are calling saying, hey, this person is seeking these services, and we'll arrange, you know, to even go pick that individual up if need be. So when the consumer is there, really what we're trying to do is make sure that we're connecting them to services, whether, like Natalie said, it may be to our assessment center, it may be to other services that we offer, community resources, maybe, they're looking for, a provider out in the community, and we're really trying to link them to those services. So SAIL will also help connect you to those services while you're there. If you have appointments, we'll obviously help you get to your appointment as well. While you're at SAIL, obviously, we provide, beds and food and all that lovely stuff. But on top of that, what we're really focusing on is the individual's mental health state and making sure that we're doing our groups that happen a few times per day. We have times for consumers to meet, and not specific times, but any time that they're there. If they need to speak to somebody, we really try to make sure that we're intervening with that individual to make sure that they're planning for their discharge, what are they faced with, and so forth.
So yes, we do our groups during the day. If they have a case manager from one of the other programs, like the CCS program, the CSP program, the ongoing crisis program like we talked about, they can meet with those case managers there. In order to come to SAIL, you must be over 18. You have to be able to do your kind of normal activities of daily living. We don't have any medical staff at SAIL. It's crisis health techs and crisis professionals who are working that 24/7. They try to keep everybody, they are working on like our goal, or start over. The groups that we provide might maybe have to do with coping skills, depression symptoms, again, activities of daily living, how to structure your day, how to get connected to resources, whatever that kind of the topic du jour of that milieu needs, or that group needs, because it changes from day to day depending on who's there. Part of being at SAIL is that people bring their medications in, so sometimes it's like it's that in between. SAIL's kind of the in between a hospital and being at home by yourself. So if you need extra support, you need someone to talk to at 3 a.m. There's a sales staff worker that you could, can't sleep and get out of bed and go talk to somebody. Sometimes people just need a little bit of help with regulating their medication, so it's like it's an extra support there to, hey, Johnny, did you take your medication today? I think it's time to take your meds. It's 8 a.m. You need to get up. It's and try to get back on that sleep schedule, get back on that normal daily everyday. You get up, you eat, you move around, try not to stay in bed all day, things like that. So. Like Jelena said, average length stays 3 to 5 days. That waxes and wanes depending on who's there and what's going on with that person. But overall, all of the services we talked about today can all be accessed by calling our crisis line. So the crisis line is the front door for all mental health services in Racine County. If you're interested in the CCS program, the CSP program, having somebody from mobile come out to you, coming to SAIL, again, you can walk into the assessment center and SAIL. But if you have questions about yes. If you have questions about any of those programs, then calling that 638-6741 number is the number you want to call. Yes, the assessment center is at 1717 Taylor Avenue in the first floor of Human Services on the south side. The north side is Workforce Development, south side is Human Services. And then like we said before, SAIL is at 2000 Dominic, it's down in the valley there. But that's kind of all the services that we wanted to talk about that the county is offering currently. Does anybody have questions? We've taken quite a bit of the time.
Is the assessment center just 18 and over, or
No, you can use do.
Okay.
Is that relatively new? Because the walk-ins, could you talk a little about the timing of that when it started?
You're gonna make me think.
Sorry, I know you've been working on it.
We have been working on it for a while. It's a program we brought back. So under our crisis certification, we've always had walk-in capability. So we had just kind of rebranded it and are kind of trying to publicize it a little bit more now because it wasn't being utilized very much by the community. So it really started going again in January of this year. We have 3 now assessment center workers, crisis workers in that area waiting for people to come in and talk with them. So like we said, it's usually about 8 to 5 is when they're there, and looking to expand those hours once we figure out what the community's needs are maybe expanding locations once we figure out, again, looking at what the community's needs are, so. Right, you got a question?
People can come off the streets essentially, right, and come to these crisis services?
Yes,
Okay.
it happens all the time. We do ask that you, if you've been drinking, because we have no medical staff there, we do ask that people be under a 0.2, and I know people don't have breathalyzers at home, but we will help you with that. If you've been using drugs, we might ask you to go to the ER just so we're sure that you're not detoxing or going to go through withdrawals at sale. That being said, if you were to have some kind of medical concern or emergency, we would help you get to the ER, call EMS or whatever needed to help with that. So
And how long does somebody stay in Salem?
about 3 to 5 days, but it also might depend on what's going on with you.
Okay.
Can you talk a little bit about the proposed integrated mental health services center?
The new building. So, yes, so ever since COVID, my brain has a hard time remembering dates. It just, like, everything blends together now.
That's been going on a lot longer
I
than
know,
that.
so I want to say it was March. I know it snowed.
It was a very cold day in March.
It snowed, that's what I remember. And it wasn't supposed to, I think it all of a sudden appeared that day. Our county executive, Jonathan Delagrave, he announced that we will be building a $25 million building to build a integrated mental health substance abuse treatment program. So what will be going in there is a substance abuse residential program that is slated to be 13 to 15 beds. I can't remember, I think that's correct.
Yeah, that's correct.
Partly that depends on, we're working with architects now to design that, what exactly that building will look like, and so part of the bed space is dependent on, how many rooms they can fit in that building. Sale will also eventually go there, once the building gets built, so Sale will have a brand new building. Our sale program got displaced when we had the Great Flood of 2015. So we have been building hopping a little bit for the last several years. And this will then be our permanent home. So we're very excited about it.
So it's basically one access point for the full range of services for helps.
Yes, and we'll be it's a campus model. So the proposed site is across the street from 1717 Taylor. So there was still, at 1717 Taylor, workforce development is still there. So all those other county programs and services are in walking distance. You had a question. I did not forget you.
Thank you. Yes, I was wondering approximately how long somebody would wait for a mobile response.
Yes. Okay.
I feel like we answered all the questions.
So with mobile response, typically per shift, there's probably about 2 to 3 workers. We do answer for the entire county of Racine, so West End all the way, to the lake where we're at right now. With that being said, typically what we try to do is make sure that if an individual is obviously in a safe place, a hospital, they're with law enforcement, they're being taken care of. If there's any imminent stuff that's going on, we're always trying to get there right away. But there's times that there will be a little bit of lag time if we're tied up at the hospital, if there's another worker that's tied up in another case. We try to get there as fast as we can, which we know at Ascension or here even at Aurora, it's a skip and a hop. The Burlington Aurora is a little bit further for us, but we really do try to get there. There's not a definite time I can provide to you, but we try to keep the wait time under 60 minutes for sure. Typically there's times that we can be there in 10-15 minutes if it's down the street at the hospital and we're not backed up on calls. But I think obviously with the county's budget we've been able to increase the amount of jobs and availability of staff that we have, which is definitely something that we take great pride in and we're excited about, so we're able to respond faster with the amount of workers that we have now.
So it's something that we kind of always look at too, is like, when are we getting the most calls in? So dependent on historically the last several years, the majority of our calls will come in on second shift. Because people get home from school, some people get home from work, it's, when the night comes and things start looking a little differently. So we have just proportionally more people on second shift to try to cut down the wait times as much as we can. But if you're, you know, if you are downtown here working with somebody and then you get a call in Burlington, we obviously wanna finish this call, excuse me, and give that consumer our full attention before we, you know, leave and go respond to across the county. So that's why she was saying, you know, we can't always predict how long it might be.
Seems like your response times though are very efficient and sometimes maybe even more so than somebody calling 911, so good job.
They try.
We also, the other thing I wanna speak about, and we're gonna hand the microphone over before they steal it from us down the table here. But the other thing that we really try to do is, team up with law enforcement to make sure that we're getting the officers back on the street. And we're really trying to take that approach for the folks that are dealing with mental health crises, and they don't need that law enforcement interaction. Law enforcement may get the call first, and, you know, they may initiate a call to us, or that individual has already contacted us. So once we get out there, we will go ahead and, you know, release law enforcement, say, no, we have the situation. Even if the individual needs to, you know, at times be taken to the hospital, you know, we're able to provide, you know, transport, obviously if there's no medical emergency involved. And we really have tried to build that rapport. We know sometimes that individuals going through and having, you know, different symptomology and that sort of things can struggle with law enforcement being there. So that's one positive step that we've taken in the right direction. Should we pass it?
Any other questions before I make it go?
Thank you, Jelena and Amanda.
Thank you. People have to hear you.
Sorry.
Okay, you're on. Next is Reynaldo from Children of Wisconsin. Oh, sorry.
Thank you. Well, hello everybody. Once again, my name is Reynaldo Ortiz. I am a child and family therapist in training, working with Racine Unified School District. I currently work in the Julian Thomas Elementary School, to be more specific. And some of the things that we're doing in Racine is that we have these school-based mental health clinics in 7 different schools in the county, where we can provide either short-term or long-term therapy as it's needed for the kiddos. We handle an array of diagnoses, and we also help provide any other support that's needed. We meet with the kiddos pretty much where they're at. They're in the schools, so we collaborate with the teachers, we collaborate with the principals, and we just try to help as much as we can while they're with us in our sessions. It's very important for us to be there. Some of the benefits is that we're right there, so we can help with early intervention. Some people are not trained in mental health and de-escalating different situations, and that's some of the things that we can do if we have that relationship with the schools and the teachers and the other staff. And just connecting with the kiddos at the school as well is very important, since they're with us right there. And we minimize a lot of the barriers that some of the kiddos and families can encounter because of, you know, just being in the school and not an outpatient setting like in the downtown Racine or somewhere more remote. We have our own little offices or rooms in the different schools, and the kiddos meet with us, we meet with them. We do intakes with the families, we get them all together, we ask the most relevant questions, see what the need is, and just go forward from there. And we can meet with the kids either once a week, twice a week, every 2 weeks. It just depends on what the need is. And our goal is to minimize the cost as much as we can to almost none, because we believe that we want to make mental health accessible, and that starts in our schools. But other than that, I don't have much information to provide, but if you have any questions, I'm more than happy to answer.
So the services are school-based,
Correct.
and there's multiple schools in Racine Unified that now have school-based clinics, is that correct?
Yes, correct. Currently, we are partnered with Waterwitz, NAP, Julian Thomas, which is the one that I work in, Mitchell, Park, Jerstack, and Case. All those 7 clinics that we have in the schools. This one is not a school clinic, but we do have an additional clinic at our Mount Pleasant location. And parents are more than welcome to bring kids to our clinic over there or to our schools. And we also I can meet with a specific kiddo in the school, but I can also meet with their siblings if they need the services. We can also meet as family sessions, and provide just an array of services that we can. If it's within our reach, then that's what we try to do.
Are the children referred to you and other clinicians by teachers, other counselors?
So pretty much every single school will have their own way of doing the referrals. It would pretty much start with the teacher. They're the ones that see the kids every day. They're the ones that pick up on certain behaviors and things like different changes. So they would reach out to their social worker of that school or social workers, and they would help process all the paperwork. They were in contact with the parents, and once that paperwork is finalized, then we as a clinic, we get the referral sent to us, and then we would just follow up with the parents. Once again, we would establish a date to meet in our clinic, and then we would just move forward from there and start seeing the kiddos as much as we can, depending on the frequency and need, just after that session. So it just starts with the teacher, which is very important because they're the ones, again, that see everything else. And then we just move forward from there.
Can parents also request if something's going on at home? Can they request that service?
Yes. Most of the times, teachers pick up on these things.
I didn't quite hear the question.
I just asked if parents could request the service if something happens at home.
Good question.
Yep, and because of the nature of us being in the school, parents have relationship with the teachers, and some of them just know each other really well, and they can just say like, oh, my kiddo is going through this and I really don't know what to do, and the teacher can remember like, oh wait, we do have a clinic with children in the school, would you be interested in being referred to that? And then they can just start the same process and just go to the social worker, and then they will come to us. So there really isn't a limit of how to get with us in our list for treatment. If you have the need, you can just contact the school staff, and somehow it will get to us, and we will work with that.
You mentioned that you try to help parents to reduce the cost, either free or not. Is there a process for that? Is there an application process to reduce the cost or have free?
Yeah, so there would be different avenues to explore with that. If we notice that they have a special need, we can put in one of our requests with our care navigators, or just have a consultation with our supervisors, and then we'll be given a direction on how to proceed. We try as children's, again, to minimize the cost as much as we can. We're also partnered with Racine Unified, and on their end, they're also very diligent in trying to do the same thing as we are, just to provide the services that they need, all of them if they can, to no cost as well. So we are two different entities, but we're also collaborating with the same end. So we have kind of similar way to get those resources.
And this is mainly therapy.
Correct. So it could be, let's say, one of the most common ones I've been getting so far, some behavioral issues. Some parents are not really sure how to handle those behaviors, or really don't know where they come from. That's one of the things that we can work with and just understand, oh, this is where this behavior specifically is coming from. Oh, this specifically has a name. This is a adjustment disorder. We explain what this is. So it's not just, okay, sit with me and I'll tell you what to do. I'll sit with you, I'll teach you coping skills and just go forward. But I would also explain what all of it is. I won't just say, oh, you have this specific diagnosis. No, I'll be like, okay, so this is what you're telling me, and this is how it's demonstrated, and this is how you can be feeling. And so we just mainly also focus on that educational piece, because it's not just sit down and I'll tell you what to do. We're collaborating, we're teaching you, because we teach you, others will see that, and more people will know about what we're doing, and that also helps us reduce the stigma around mental health.
How would you evaluate the need for mental health services in the school as compared to the availability?
So, aside from the intake that we do with the parents and their kiddos, we would also reach out to the teachers and the social worker to not just collaborate and verify, but to get additional information. Like, okay, this is the chief complaint that we're getting. What else have you noticed in the schools? How does the kiddo behave in the classroom every single day? And that also helps us determine, like, okay, this kiddo is fit to receive services. And we don't really keep kids away from services. Some kiddos might just have some needs, but they're really short term. We're more than able to provide a month, 2 months of treatment if it's needed. And along the way, if we notice that they need more than those 2 months, we can just reevaluate. Any questions from the public?
Thank you, Reynaldo.
Thank you guys.
Now we'll ask Amanda with.
Well,
We have a
I'm
question.
sorry.
I've got some questions, but this is for anybody on the panel. So do you just offer services for children, or do you offer services for like, adult family homes in Racine?
So, you guys are gonna more of that.
Yeah.
So, I know you guys walked in a little bit late, so we're with Behavioral Health Services of the county. To answer your question, the services that we provide, some more than others, would be for people who are living in adult family homes or crisis behavioral services. Mainly, probably our crisis program would be the best fit for that group. And we can touch base after if you wanted. You have more questions about that too, so.
And then just answer on my end as well. I'm mainly with children's in the schools. If families want to be involved in those sessions, that's when we extend that additional service as well. But it's mainly catered for children's.
And I'm from public health for the county, and we don't provide direct services, but we do address mental health from birth to adulthood, so we'll touch on everybody.
Yeah, so, time for introduction. So, our next panelist, Amanda Busack, who is with Racine County Public Health Division, and we're asking Amanda to give us an overview of areas where the Public Health Division engages mental health issues and concerns. Amanda.
So again, Amanda Busack, Public Health. I typically cover our mental health, suicide prevention, and our overdose awareness and prevention initiatives for the county. So the way that public health functions, like I said, we don't necessarily provide direct services in mental health, but our role is more to see what's going on countywide, look at the amazing services being provided elsewhere, and finding ways to connect the public with those services. Where are the gaps? Where is this information being stored, and how are we able to get people to where they need to be? Sometimes that accessibility or awareness just isn't there. So that's primarily what we'll do by partnering with organizations like NAMI, behavioral health. A few of the ways that we do that, starting kind of with our youngest group, we have a universal home visiting program. So that is our parents who are within those first couple of weeks after birth. So they'll have a nurse come out to the home, typically around week 3, do a physical assessment for mom and baby. And then they'll also do mental health screenings at that point. There's lots of education and support at that visit. And then we do a longer term home visiting program that would help work with families, siblings, all kinds of goal setting, but it also addresses some of those mental health concerns along the way. We also take into account our mental health services when we're working with our overdose prevention. Those two go hand in hand. So that's something that we've been working on over the past several years. And then we have an adolescent suicide prevention initiative. You've probably seen these guys floating around our 988 labels or cards. We have them printed on business IDs, school IDs. We've got them on handouts. They've been on keychains and church bulletins. So it's essentially trying to get this existing service that we've all heard about into the hands of individuals when they need it. So I had the pleasure of being at an event a week ago, and one of our high school students came up and showed me that she had her 988 card placed inside of her phone case, so it's always in her hand, which was wonderful to see. So people getting really creative with that. Those are available, again, countywide. We are very flexible if you want them on stickers, or if you want the image to be printed on whatever you want it. Like I said, we have key tags, phone cases, things like that. So that's something that it's available for businesses and organizations, schools, but also if it's just a community group or somebody who's interested in having that information available, we can do that. And then lastly, our biggest initiative this year around mental health, which we're very excited, we're gonna be working with NAMI on this as well, is our introduction of MAM therapy to southeastern Wisconsin. So a little bit of data behind this. I know we don't see a ton of mental health info for men. But suicide death rates for men are 4 times higher than women. So with women, typically what we see is the self-harm, the emergency department visits, the attempts. With men, they tend to use a more lethal means. It's one and done. We don't have an opportunity for intervention with them. They also tend not to be help-seeking individuals, so they're not reaching out to their doctor, not reaching out to a therapist or another support group. And if they do, the really unfortunate part is we have an issue with diagnosis of mental health for men. It's underreported, but even the symptoms that are reported for men tend to be not your typical mental health symptoms, so it's not raising that red flag for providers. So even if they're screening, they may not be picking up on some of those issues that we need to address. So across the board, we have a really hard time engaging the male population, not just here in Racine County, nationwide. So what do we do with that? The Man Therapy program that we're bringing to Racine County, very excited about this. It's a 24/7 digital platform, so it's all online. It's free, it's anonymous, it's backed by science, and all of it happens in the privacy of your own home. So it's not necessarily the one-on-one you're talking to a therapist, but what you would do is go online, complete an assessment, and then they'll give you tools that you can work on at home all by yourself until you're ready to reach out and speak to somebody. The edge that they use is using humor with masculine stereotypes to get over that stigma. Very funny videos. You'll see coming up with the launch of this next week. Dr. Rich Mahogany is their main character, their therapist, and he's the one who provides these funny videos and tips on mental health, along with the serious bits of, you know, if you have anxiety or depression, here are some things you can do at home. And if you screen high enough on that assessment, I really want you to reach out to somebody. There's also crisis services available right on the website. So in the corner of the website, there's a little red phone, and that will connect you either to 988, so you can call, text, or chat with them, or directly to Veterans Crisis Line, which is really exciting to have that direct connection to them. One thing that we know as far as those masculine stereotypes go is that self-reliance, that independence, the stoicism, tend to keep to yourself and want to do it yourself, and that's what this platform is going to provide, is an opportunity to work on some of those mental health issues at home, in private, and then eventually be able to connect to Racine County services. So we'll have up to 20 local services and resources available right on the Man Therapy website. So they'll be able to connect with the great organizations we have here today and get help they need, or connect with crisis services if needed. So you'll be seeing a bunch of that coming out soon, and we're very excited to share that information. I think I covered pretty much everything for public health. Any questions?
Can you kind of share your perspective on the impact of the 988 crisis hotline since it rolled out last summer, and the impact of Racine County from your view?
Absolutely. So I think one of the biggest things is having the easy to remember number, just like we have for 911. 988 is super easy to remember, so it's not necessarily that we're having to, you know, share these flyers everywhere. It's nice to have it in hand, but it's super easy to remember. The other thing that I love, especially in regards to not just youth, but I would say, you know, a lot of our age groups now, they don't necessarily want to make the phone call. They may not want to talk to somebody even in crisis. You have the option to text or chat, which is much more comfortable for a lot of people. So I think having that option available is wonderful. The other thing I like to highlight with 988 is it's not only if you yourself are in crisis. So for instance, for me, if my spouse is going through something and I'm not sure how to handle or help, I can call or chat with 988 and say, hey, here's what I'm seeing, what do I do, who can I connect with? So it doesn't have to be an immediate emergency, it can just be that help seeking that you need. So it can be anyone to contact them. A lot of times with both mental health and with our overdose response, we see that it's a loved one, a friend, a family member, a parent, a sibling that's reaching out on behalf of the person who needs services. So it's really nice.
If someone calls 988 in Racine County, they're all to be connected in most cases to our local hotline. Is that correct?
Everything
Or is
will
that
go to
separate?
988 directly.
988.
So 988 gets answered by an organization.
Sorry guys.
You're good.
It's like I give you a cough drop, it's not on my head over there. 98 gets answered by is it Northwest Connections or, I'm trying to remember, it's
I
an
don't want to
organization.
misspeak now.
Yeah, it's an organization.
Was it Family Services? We'll leave
Nope,
that
I'm
alone.
not gonna,
We're not
just
gonna
pretend
guess.
I don't know that. It gets answered by an organization that is kind of more in the middle of the state, and so all the phone calls get funneled there. If they find that there's somebody who is in imminent need, they will then, yes, call us back or tap us in at that point, and we'll dispatch somebody from a log.
Some of the early statistics of that is that many people are helped when they call the hotline. There's no further action required. Is that your experience, at least in that situation?
Yeah, they do a really great job as far as over the phone assistance and support. So if it's something that you call in and you're having, anxiety or panic attack, and they're able to just keep you on the line, which is super important, and make sure that they're giving you the help you need, there may not be a need for a medical or law enforcement intervention. Like I said, it really runs the gamut. If you're not the one having the crisis, you can do your entire phone call and just get some guidance, some advice on what to do next. Get connected to resources. Maybe it's not an immediate need, but tomorrow you may want to reach out and call behavioral health and get in with them for one of their services. So it's a pretty broad spectrum of who can call in and get out there.
Could you talk a little bit more about your overdose prevention work?
Absolutely. So we have seen record numbers, unfortunately, this year, as particularly with fentanyl in Racine County. Compared to last year, we're in, I believe, week 19, 20 so far, and compared to the first 20 weeks of last year, we're up over 200% as far as overdose rates, suspected overdose rates, and that's specific to opioids. So we launched just this week on May 9th, which is Fentanyl Awareness Day. We launched a fentanyl awareness campaign. Trying to get this information just as saturated in the community as possible. It's everywhere. So we're seeing it not only in heroin and cocaine and particularly counterfeit pills, but also in marijuana and mixed in drugs that you aren't expecting it to be in. So there are individuals that seek that out, but there are definitely individuals that unknowingly end up taking fentanyl and overdosing from it. So what we do at the county is we work with law enforcement, CPS, behavioral health, our first responders, our hospitals, and we try to work on what information we've seen come in, what's the current trends, and how can we get that information to the public. We are also, like I said at the beginning, trying to connect those services up. So if somebody comes in who is struggling with substance use disorder and they come in, let's say, through law enforcement, how are we getting them from law enforcement to either behavioral health? Do they need a hospital stay? What service do they need next? And how are we getting them potentially the treatment they need, but if not the treatment, the harm reduction services? How can we keep you safe and make sure that if you have another overdose, that you survive and that we can connect you at that point? So we do work really closely with our first responders on that piece, but we're looking into working with like our emergency departments and how can we make sure that someone who goes into the hospital for an overdose is then getting referred to harm reduction or treatment services afterwards. So that's kind of our role in the overdose prevention, is being the connector and the facilitator of these conversations, and this disseminating the information as much as we can in the community. So we are also working on saturating more with Narcan, of course, which is super important. Narcan you can get at behavioral health services. You can also get at the City of Racine Health Department. And we do have an online resource that we just found. You can get mail order naloxone. So I did try that out. I got the injection kind of naloxone, so it's not the nasal spray. But I did an online training and it came in less than 2 weeks in the mail. So we have lots of options now. We do have a splash page for all of the fentanyl awareness campaign materials, and all of those resources are on there, so I can share that as well. But yeah, they go hand in hand, absolutely. And what we're seeing a lot with our overdose cases is that there is some history of mental health that either hasn't been diagnosed, hasn't been treated, but the family or next of kin is usually reporting that there's some history of trauma or mental health issues.
Thank you.
What's the expectation for the campaign to reach out to men and mental health? I forgot the man therapy campaign. So what is it? I mean, I'm assuming that there's mid-term and long-term expectation.
Yeah, so we're going to do a larger launch up front. The Man Therapy website is independent of anything the health department's doing or the county's doing. So our job is again marketing that and trying to drive traffic there. So it's never going to go away, but we're definitely doing a big push around it this year. In particular with coming out of the pandemic, we've seen the impact of that on mental health. Like I said, the overdose rates are really impacting it as well. So we will be pushing out a lot of those funny videos that you've seen, and then we have particular demographics that we're trying to hit with that. So construction, our veterans and military service, our first responders, particularly agriculture and rural populations. Older men in those areas tend to have a lot more a hard time reaching out for help or being diagnosed with a mental health concern. So we will be individually reaching out to those communities and marketing to them. And Man Therapy's done a wonderful job of creating those materials for us. So they've tested these messages and images and making sure that that's something that resonates with those demographics. So we really get to take their work and then just bring it to our communities and implement it. So you will be seeing the saturated general public information, but we will be doing a lot of kind of in-depth work with those particular fields.
Other questions for our esteemed panelists?
You mentioned the need that you sometimes go to the hospital. What's the expectation of the hospital of you all thereafter? I find it interesting that you are called into the hospital.
So many a times when we get contacted by the hospital, it's the social worker contacting us, typically to the local emergency room. Sometimes, you know, they can be medically admitted. The individual may have came in, it may be an overdose attempt, unfortunately. So when we go in afterwards, that individual may not be willing to avail themselves to mental health services, or the social worker has hit a, you know, brick wall with trying to find where that individual can go. So we will come in and do that mental health assessment to try, you know, if there may not be a bed available, and we're trying to advocate for them, you know, by whatever means we need to, of maybe keeping them there a little bit longer to find them a bed, or us filling that bridge with our SAIL program, the crisis hostel, bringing them there where we know we have eyes on the individual, they're safe with us, and say a bed may open up the next day, we'll decide to, you know, we can take them back to the ER at that point in time. The last snippet of that would be, you know, if there's social work team involved, law enforcement involved, whoever the attending physician may have concerns of safety for that individual. And what we're really coming in to do is complete our assessment to identify what the appropriate plan would be for that individual to, you know, is it safe for them to return home, you know, with resources, a safety plan, somebody else, you know, stepping in and saying, I'll make sure that this individual stays safe, and, you know, I'll watch over them and make sure that they connect to services. But at times, it typically will involve, unfortunately, sometimes individuals are not willing to avail themselves to mental health services during their mental health crisis. Did that answer your question? Okay.
Other questions? I think we do have
Statement.
an announcement.
Yes.
Yes.
So thank you. So I took a lot of notes. I even saw you guys taking notes amongst yourselves about the other programs, so I hope that you found this valuable also. I know that everybody here did. And I wanted to open it up to anybody else in the audience who might have other resources that they want to share, because this is being recorded and will be released on multiple platforms. If there's other things that we should share with the public, I invite you to come up and share those now.
I think we have
Your groups. Your groups.
Yep, Christina. She's got this.
Hi, I'm Christina. We just started a group 2 weeks ago for sexual assault survivors. It is a group, I'm a survivor, I'm a co-facilitator that is started it right along with a fellow co-facilitator, Scott. It's every 2 weeks, the second and fourth Friday of each month.
Friday.
Yeah, Friday 6 to 8, right? 6:30?
6:30 to 8.
6:30 to 8. It's a safe space at Calvary Chapel on Durand for anybody that has been sexually assaulted, sexually abused. It's just a place for us to come and talk to each other.
That's great. Thank you.
Thank you.
Thank you. We are very excited to offer that. Appreciate you being there and willing to support other people who have experienced that trauma. NAMI Racine County also has a number of other support groups. We'll be starting a veteran-focused support group very soon. We're bringing back the family and friends support group called Family Cares. And we have multiple peer support groups. All of our support groups are offered at no cost to anybody who wishes to attend. You can find more information at www.namiracinecounty.org/support.
Get it in there at least once.
Would anybody else like to share anything?
I'm scared. She says.
She got this. Never get this, she got
Thank you. Alright, thank you.
Hi, everybody. My name is Toyla, and I'm here from Faith Homes, Adult Family Group Home. And so we came. I thank you for that information. I'd like to give it to you afterwards. So got a few people that I might be able to connect you with. But we wanted to get some information on how we could help the community and with the group home business. Sometimes we struggle with finding resources for the clients, especially with crisis. Thank you for that. 988 information. I got it now. All right. So yeah, that's why we're here and kind of rub some shoulders and get to know some people. Okay. All right. Thank you.
Thank you.
And there are additional resources that some of the different organizations have brought here. You can certainly review those in front if you would like to take any information with you.
And I'm happy to talk to you after.
Okay.
There we go. So let's give a round of applause to our
Esteemed panelists, thank you so much for being with us this evening, sharing your knowledge. And as Bridget said, we're going to broadcast this information to the general public through our various platforms. So look for some of that content as we go forward. And thank you all very much for being here this evening, and drive safely home. Thank you.
Thank you.